Good afternoon, Minnesota. Uh, as you're well aware of, there's been developments in DC over the last few minutes as we prepared for this announcement to talk about some of the measures around COVID-19. I just want to take just a moment to assure Minnesotans um, that the situation here is calm and stable. I just was speaking in contact with Senate Majority Leader Gazelka, a man of honor, a friend, and the two of us are in absolute alignment that the sacredness of our democracy, the ability to disagree agreeably, um, is fundamental. And as you're watching things unfold and as stability gets brought back in, know here in Minnesota that we understand this, that when our politics gets to the point where everything becomes so fractured, it's very difficult. It's very difficult to run society that way. And so I want to acknowledge that eyes are on what's happening in DC, but also to acknowledge here that the Minnesota way of doing things is still stable. We disagree on certain things, but our values are the same. So I want to take just a few minutes today to update us on where we're at with COVID-19. I do want to acknowledge I had asked some folks here who have lived through this, restaurant owners who have bearing the brunt, both from an economic perspective and the mental perspective of what this has done, and then healthcare providers, a nurse who has seen this from the beginning and last week was one of our earliest folks to receive the vaccine. We're not going to be speaking with them today. I'll bring them back up again to talk about it, but this is a great example. There's not us against them. We're all in this together. And I just want to note with COVID-19, some of the announcements we're going to make, there's reasons to be optimistic around this issue. Thousands, almost 100,000 or more as we speak today have been vaccinated. Those are our frontline nurses. There are long-term care. They're the folks that are most vulnerable. And that's only accelerating. We got notice yesterday we'll receive another 66,000 doses by Monday. So it will start to continue on. Our little ones are going back to school. My little guy, my 8th grader, participated in youth sports for the first time in a very, very long time. And I almost had tears in my eyes last night. He came home with a sense of joy, with a sense of that we can do this. And it's been hard. And I understand that. And it's a lot of stress on a lot of people. But your sacrifices have changed this trajectory. We've asked much of you, Minnesota, and you've risen to the occasion. And by rising to the occasion, it means making sure that not only these healthcare providers are protected and we don't overrun our hospitals, but that we get our economy back and we start getting back into these wonderful places that are far more than places just to grab a hamburger. It's where all of those important things in our life happen, from birthdays to anniversaries to just great times. So, again, as I said, over 80,000, that's 100,000 of now. Our doses are limited. They're coming from the federal government, but the state is doing, and we work with the hospitals, we work with the pharmacies, the Department of Corrections, all those folks working together to get this out as quickly as possible. So we'll continue on. And as I said, if you're thinking this is too slow, I'm right with you. Whatever pace we're getting vaccines out, it's too slow across the country. So just so you keep that in mind, we'll continue to push that envelope, but always doing it as safely as possible and making sure we're following the ethics of who's getting it when they're getting it. Again, help for our families. Our little learners are back in the classroom. State legislature, I want to thank them again in Congress. Checks will be going out. Department of Revenue and Commissioner Grove at DEED have talked about this, should be going out early next week to provide some of that relief to these bar owners, to the restaurants, to the entities that were asked to close down to stop the spread of COVID. And we're working together to bridge that gap. It's going to be a while, Minnesota. It's going to be a while till we get all of the vaccines, but the game is changing every single day. When I've got a nurse sitting here today that has received the vaccine, that is huge. It is huge for you if you need care, that she can be at work, and it's huge for her family, that she can go home and not worry that she's bringing it home to her little ones or to her family. And here's what you're looking at, Minnesota. The chart that you're viewing there starts last February when our first case showed up until we're at today. And that peak was the November, December surge that we knew was coming. At that point in time, there was one point in a couple days in December when Minnesota had the highest infection rates in the world, and that our hospitals were approaching 98% capacity. But through a lot of hard work and a lot of planning and a lot of sacrifice by Minnesotans, everybody who needed a bed got one. Everybody who needed PPE had it there to to make sure they were protected, and all of the therapeutics, ventilators, bottled oxygen, whatever it was provided to them. That is a promise that we need to keep to every Minnesotan. Should you need to be in the hospital, whether it's COVID related or something else, they're there for you. And you responded. New cases are down. We're approaching pre-surge levels. And if you look at this chart, if you see where it goes way up, then it comes back down, that little bump on the downward slide, that's Thanksgiving. Now what you're seeing at the bottom, you'll probably see another little bump. That's Christmas. But here's the deal, Minnesota. It's a tiny bump. That means most of you did the hard things and you stayed home, you social distance, you got tests, you isolated if you had it. And what that did was that made sure that nurse didn't have to have someone else come in, or that we needed to have to shift people to another hospital. And the good news is, by doing this, we start to make some difference. Community spread is still out there. We can't let our guard down. Too many people get infected. We don't know where it comes from. Hospitalizations are declining, but it's still, again, I think this is our new normal, still at a very high level if you look back compared to where we were in May. So we've got work to do there. But we know what keeps us safe, and I'll come back to this. I've heard this a lot of times: personal responsibility, and Minnesotans, you're doing that. This idea that that you are responsible to a certain degree on the health of not only your family, but your neighbor, by wearing the mask, by social distancing, by doing those things. And I want to note that our businesses, whether they be manufacturing, retail, or an industry we're talking quite a bit about today, hospitality, bars, and restaurants, they're doing it. They're doing it to keep their folks healthy. They're doing it to keep the folks who come in to eat there healthy. And they're doing it to make sure that our economy continues to open up. So we're going to ask you, keep wearing the mask, keep the physical distancing, stay home if you're sick. Testing. This week came out, there's a group, IBX, involved. They do testing in all 50 states. They're the biggest testing in there. They noted that no state is more aggressive and no state has an easier way to get tests than the state of Minnesota. Again, this was a partnership between the University of Minnesota, the Mayo Clinic, a lot of others, and the private sector working with the state to provide that. So again, if you need a test, get one. If you're not sure you got exposed, if you were at Christmas with someone, do that. The reason we ask for this is, it's no shame. If you happen to pick this up, we know then to get you the care if you need it. If you're asymptomatic and you're not good, and that's a large number of people, but that keeps you isolated from spreading it further. That keeps bringing that curve down. So here's what we've done throughout this whole thing. In March, we flattened the curve. And if you look at the curve along the United States, we stayed flatter than any other state for a longer period of time. We managed it through the summer. Businesses got super creative. They found new ways to do this. There was a lot of outdoor dining. They did a lot of things. But November came. We saw us moving back in. We saw the virus come back to the upper Midwest. And quite honestly, we saw a lot of places that just simply said, well, there's nothing we can do about this. When I mean places that certain states said it doesn't matter. We do know it matters, because if you compare states and you look at infection rates or death rates, in states that chose not to take mitigation measures, they're twice as high. And what that meant was there were more people in the hospital. It also means in the long run, there's more people that may have long-term implications from this. The interesting thing, and I think folks in this industry, especially bars and restaurants, understand, consumer confidence of coming in and feeling safe is the absolute key. Being a place that's safe and has great food and they know that everything's healthy, that's where people are going to. And so we want to make sure that as we did that, that we help them. So we turned the dial back. We asked them to sacrifice. We asked the state and the federal government to provide some relief for them, because all of the rest of us benefit when those businesses were slowed down. But you did it. And so what we want to do is we want to make some changes. We want to change the dial a little bit, and we used it as a dial. It's not an off-on switch. I think a lot of folks would say, you know, we have to open up Minnesota. Minnesota's never been closed. There's been many things that have happened. Certain sectors of the economy have been asked, and that's why we continue to ask those sectors that have sacrificed. We need to help them out, making sure that there's aid there. And now the way we help them out is, let's not let the virus surge again. So we're going to make some changes today, and I'm asking again on this personal responsibility thing. The strongest thing you can do by wearing a mask and social distancing, that keeps your local bar and restaurant open. It keeps your school open. It keeps your hospital capacity under. And we know that the data supports it strongly. Those simple measures of masking, social distancing, washing hands, and staying home if you're sick make the biggest impact. So again, I'll just do it briefly here for all of you, how these decisions are made, listening to a whole spectrum of public health experts. I talked to every one of the healthcare CEOs. We talked to the epidemiologists at the University of Minnesota, the Mayo Clinic, at the Minnesota Department of Health. We also talked to the business community, folks who know how this works. Here's what's happening in our setting. Here's what it looks like. Here's what we can do to mitigate the spread. And we talked to folks who understand that there are implications of this. And I know all of you are going through this. That overwhelming emotion I had last night to see my little guy coming home smiling after a sports practice for the first time in many months was overwhelming. There's a mental health piece that goes with this that we're very, very well aware of. Trying to get that well-being, the economy, and controlling the spread is where we're at in the middle. And so we're going to cautiously talk about loosening some of these restrictions to make sure that we spread out to help in some of those other areas. So I'll go through this quickly. I've got Commissioner Grove here, who's an expert on this. All of this information will be online. We'll get it out there to more folks. The media will do a good job of disseminating this information. But restaurants and bars are going to go back to 50% capacity, looking like we were in the summer. 150 people maximum. They can do, again, thank you to this, Minnesota. There were some that scoffed at the idea of outdoor dining in December. And I heard several restaurants and breweries say they did a pretty brisk business, and no pun intended, that there were a lot of folks there because Minnesotans are pretty hardy people. And business owners, entrepreneurs are pretty innovative on how they figure out how to do these things. And they've done it in a way to keep people safe. So we're going to ask keep the 6 feet, 6 people at a table, ask for masks, and then the 10 p.m. stop serving of food at that point in time. Again, it's the turning of the dial. As we continue, we're still at a fairly high rate of infection, but obviously, as you saw in the chart, much lower than we were in December and in November, gives us the ability, if we get this right, to keep turning that. Obviously, the goals here, as we slow the spread of the virus, as we open up some of our business cautiously with that dial, now the new game changer is every single day we're vaccinating tens of thousands of people. We're going to hit a critical mass here at some point in time where all of our frontline healthcare workers, all of our most vulnerable, all of our seniors are vaccinated, and then we'll get to all the rest of us that will help slow the spread of this. But the dire situation of deaths and hospitalizations are going to be reduced relatively quickly. And the way we help them is by continuing to just follow these guidance. And again, our restaurants can do this. They can do it safely. The health data supports them on this. Let's not let it get back up again. Bowling alleys, movie theaters, other indoor entertainment, 25%, 150 maximum people. Again, we can make this happen. We can do this. These are businesses that can come back online. And this goes back to that well-being as well as the economy. Small social gatherings, again, keeping the household small, not mixing. We still know this is a major source of transmission, is where lots of people gather in a home, either to watch a football game, celebrate a birthday, do something like that. Those we still need to keep an eye on. And I think the good news is, the times when that would be the most prevalent over the holidays, it appears like Minnesotans did a pretty good job of stopping that spread. Gyms and fitness studios, there's going to be a little higher max. Classes are opening back up. And then, of course, outdoor events and entertainment, which, again, Minnesotans do well. I would just say this, we'll keep our hand on the dial. States are peaking. We have mobile morgue trucks and a shortage of body bags in LA County. Arizona is peaking back again. This thing seems to move to different regional parts. The upper Midwest has come back down some. There's every reason to be optimistic, Minnesota, but there's every reason to believe it can get out of hand pretty quickly, and we can spike again pretty quickly. And again, that is just a domino effect of big number of cases followed by a 2-week lag, big numbers of hospitalizations, followed by deaths. And again, yesterday was the highest death count since it started in the United States. And even here in Minnesota, with our numbers coming down dramatically, the death numbers are still lagging. We had 67 of our neighbors die yesterday of COVID-19. So there's work to be done, but we've learned a lot in 9 months. So we'll keep adjusting this, keeping Minnesotans safe, keep watching. The one thing I would say is, and it's again, knowledge is power. Not to be fearful, but to be thoughtful about this. This new variant that you're hearing about that is now in 4 states, the state of Minnesota has been looking and doing our surveillance testing. We have not found it yet. I think it is, which probability, it is probably here. Early indicators show that this variant, while not any more deadly in terms of the fatality rate, it does appear to be about 50 to 70% more contagious, which means it takes less of it, it's much quicker, and it spreads very quickly. That is something that we're tracking. It will have an impact, but it will only have an impact if we allow it to get in. And one of the ways we don't allow it to get in, wear the mask, social distancing, wash your hands, stay home if you're sick, get a test, and we can keep these things open. So, just to reiterate it, it's the same stuff. The smartphone app, I can't tell you, I think we have nearly 500,000 folks have used this. It is no invasion of privacy. It's been supported by the American Civil Liberties Union. It is totally anonymous. What happens, I would remind folks, is you download the app, totally anonymous. If you get a notice that you are COVID positive, you can, by your own free will, put that code into your phone, and it will transmit a signal to everyone via Bluetooth who was within 6 feet of you for more than 15 minutes. Just letting them know. It doesn't mean they have COVID, doesn't mean they're exposed. It just lets them know, you know what, maybe I should run and get a test. Because once again, especially with younger people, you may be totally asymptomatic. And the real problem with that is that you're going about your daily life and it's spreading to others. And so I would ask you again, if you want to use COVID Aware MN, it's a great app. It seems to be working. We hear great things about it. So Minnesota brings us to where we're at. I apologize again, going a little quickly here. This is news that matters to us. I want to send my deepest thanks to all Minnesotans who have made the sacrifices. A special thank you to all of those folks involved in the hospitality and entertainment industry. They've taken a brunt of keeping us safe. To those frontline healthcare workers who, I talked to a lot of the hospital managers last evening, saying that the lessons that they've learned, that they came through this. There were some that had served in battlefield hospitals, had served in ERs in major cities, and said for folks, for many of them, it was every hour of every day for the last 8 weeks that they were experiencing this over and over and over again. And because of what everyone has done, we've slowed the spread. We've been able to turn our dial. We're in a place right now with vaccines. If we get this right, it's our hope that we just continue to move more back to normal. So Minnesotans, on a day of, I share this with you, great uncertainty. The world's oldest democracy of 250 years, the way we've got there is by respecting one another, by compromising, by working together, by using science and innovation and compassion to come up with good solutions for one another. We're doing that around this issue of COVID. And I would remind everyone that it is our responsibility as elected officials to demonstrate that to you. I just want to send a big thank you to the Minnesota legislature who's doing that. And I think in the days to come, it's going to be even more important. So thank you.